Hello guys, welcome to my channel. So today we are here to discuss about the new updates that have come regarding the transmission of COVID-19. This is an update in this month of July 2020. Let's start the video. So the first question should be that what is the most common way or common method of transmission of this virus between two people? So the current evidence suggests that the COVID-19 spreads between the people through direct, indirect, and close contact with infected people via mouth and nose secretions. Now, what do you mean by this? The indirect, it means suppose it is spreading through contaminated objects or surfaces. Okay, so these include the saliva, respiratory secretions, or secretion droplets also. These are actually released from the mouth or nose when an infected person coughs, sneezes, speaks, and when people who are in close contact, suppose within 1 meter range with another infected person, they can easily catch this COVID-19 because of those droplets that are coming out through different openings of the infected person. So what to do in this situation? It is to avoid contact with these droplets. So how would we do that? It is important to stay at least 1 meter away from others. Clean hands frequently, cover the mouth with tissue, or even you can bend your elbow for that when you are sneezing or coughing, so that your droplets are not being spread properly to the other person. Then also, when physical distancing is not possible, then what to do? We can wear a fabric mask, and it is an important measure to protect others also, not only for your own safety. And this is already established that cleaning hands is very much required, that too frequently. So the next question is, what are the other ways in which COVID-19 virus could be transmitted? So the answer for this is that people with the virus in their nose and throats may leave infected droplets on the surfaces or objects. These are also called fomites, okay? So when they sneeze, cough, or touch surfaces which they are in contact with, such as tables, doorknobs, handrails, so they leave those virus on that surface. So other people may become infected by touching these objects or surfaces. And also after they touch those surfaces, they are touching their eyes, nose, mouths before they are cleaning their hands with proper sanitization or washing their hands properly. That is why in this scenario, it is mandatory to thoroughly clean your hands regularly with soap and water, or you can also use an alcohol-based hand rub product, and to clean the surfaces also, those fomites and all. The next pertinent question is, what do we know about aerosol transmission? So I hope you have some idea about aerosol. I'll tell you. Some medical procedures can produce very small droplets, and these are actually called aerosolized droplet nuclei or aerosols, and that when they are transmitted, they are able to be suspended in air for a longer period of time. So when these kind of patients are in the hospital and this kind of medical procedures are being conducted on those people, this aerosol can contain the COVID-19 virus. So if you're not wearing the mask or personal protective equipment properly, then this aerosol may potentially be inhaled by those people. These are the healthcare professionals or the hospital staff. Anyone can be affected, nurses. So it is absolutely a requirement for all health workers performing these medical procedures to take specific steps for airborne protection, okay, including using appropriate this PPE, and visitors should not be permitted in areas where such medical procedures are being performed. So there have been this reported outbreaks of COVID-19 in some closed settings, and that caused a lot of fears in people. So such closed settings are, for example, restaurants, nightclubs, places of worship, or places of work where people may be shouting, talking, singing, and sitting together. So in this kind of places where it is crowded and inadequately ventilated, there is transmission through this aerosol. Though some more studies are needed for particularly giving a proof about the significance of transmission by this method. So sometimes we also have this question that when the infected person can transmit the virus actually. The answer to this by the current evidence that we have collected till now is that the transmission of COVID-19 is primarily occurring from people when they have symptoms. Also, they can transmit it just before they have started having symptoms. And this occurs especially when they are in close proximity to others for a prolonged period of time. The most frightening thing is the asymptomatic carriers, because some people are there who will never develop the symptoms, but they can also transmit the virus. So the answer or solution to this problem is the same, that we have to limit contact with people who are infected with COVID-19, and frequent and thorough hand cleansing and wearing a mask, and especially when the distance between two people is like less than 1 meter, we should have extra precautions. So we should always continue with the social distancing and maintain proper sanitization, wear mask and all. So this brings us to the next hot question, is that can people without the symptoms, can they be transmitting the disease? So the answer is yes. Yes, the infected people can transmit the disease both when they have the symptoms and also when they don't have the symptoms. That is why a proper detection of all the patients who are having COVID-19 is very much required, even if they don't have the symptoms. From outside, you cannot tell that that person is having COVID-19. So that is the main problem right now. Even people who have confirmed COVID-19 by laboratory tests and all clinically, but they do not have symptoms, these people should also be limited to their own houses, or they should be isolated so that they break. This is just needed for breaking the chain of transmission. So this is why we should all make a habit of staying apart from each other, at least 1 meter away. And also the same things we have to follow. You have to cover your mouth while coughing or sneezing. You can bend your elbow or use a tissue. You have to clean your hands regularly, and you have to stay at home. That is most important. And one more important thing is to wear fabric masks. One more thing we should try to understand, that what is the difference between people who are asymptomatic and people who are pre-symptomatic. Is it the same thing or is it different? So there is a slight difference. Both of these terms refer to the people who do not have symptoms, but this asymptomatic refers to people who are infected but never develop symptoms during the period of infection, while pre-symptomatic refers to infected people who have not yet developed the symptoms but do not go on to develop the symptoms even later. So the only difference is that pre-symptomatic people will not even develop the symptoms even later on after the infection. So what is our current situation? Do we have enough knowledge about all the methods of transmission, or do we need more information about this? In reality, what is happening is that each and every day some new information is coming through research, and we are getting to know new information about the virus. So definitely there are some areas we need more information on. Some of these are the different transmission routes, including through droplets of different sizes, physical contacts, fomites, and the role of airborne transmission in absence of aerosol generating procedures. Also, the dose of virus that is required for the transmission to occur, the characteristics of the people, and the situations that facilitate the spreading of the events, such as those observed in closed settings, like your office or any public place where you are gathering, like places of holy origin, temples and like that. Also, we have to find out the proportion of infected people who remain asymptomatic through the course of their infection. So is it very rare, or many people can be like that? And the proportion of truly asymptomatic persons who transmit the virus to others. These are the most dangerous people. So overall, let us summarize what are the different steps that we can take to limit the transmission of this virus. So the first point is limit close contact between infectious people and others. Ensure a physical distance of at least 1 meter from others. In areas where COVID-19 is circulating and this distance cannot be guaranteed, please wear a fabric mask. These days N95 masks are available. Even if you cannot get the N95 mask, whatever mask you can get hold of, just use it. Next is that you have to identify the infected people quickly so that they can be isolated and more care can be taken for them medically. And all the contacts for these families, okay, they should be quarantined in the appropriate facility. Next is clean hands and cover coughs and sneezes with a tissue, or you can even bend your elbow for that, just to protect others from the spread of this infection from you maybe. Then you have to avoid the crowded places. Mostly you have to stay at home, close contact settings, and confined and enclosed areas, okay, with poor ventilation. This kind of places you have to avoid. You have to ensure good ventilation in indoor settings, such as your homes and offices, okay. If you are not feeling well, then you have to contact a medical provider as soon as possible, okay, because it is needed that you have to be sure that what is the cause of your illness, if it is COVID or not. And in areas where COVID-19 is circulating, the containment zones especially, the health workers should use medical masks continuously during all routine activities in clinical areas, in healthcare facilities also. So there, the chance of aerosol transmission is also there. So we should be extra precautious. And the health workers should be provided with this personal protective equipment, and precautions should be taken while taking care of these COVID-19 patients. I hope this information will help you for whatever reasons, for personally protecting yourselves or for clarifying your doubts about these transmission methods, or even for knowledge of these healthcare workers. So we have to stay healthy and we have to support each other. We do not want to break down mentally. So mental health is also important. With that, I would like to conclude this video. Thank you all for your patient hearing. If you like the video, please subscribe, and we will meet in our next video with a new topic.